The legacy of the Ketterings is so important. People, when they hear the name Kettering Medical Center or Kettering Health Network, they feel that it's Kettering because it's in the city of Kettering. And people don't even know anymore why the city of Kettering is named Kettering.
My great-grandfather was Charles Kettering first, and he was married to Olive. Their son Eugene, he married Virginia. And then they had my father, Charles II, and his second sister was Jane, and then the youngest was Susan. So I'm the second Susan. I've gone up to pay for something and someone goes, "Oh, how cool! Your parents named you after the city." I was like, nope.
When you come to work at Kettering, you start to feel a part of something bigger than yourself, that I'm part of this enterprise, and this enterprise is here for a purpose, and great people started it.
The Kettering family, the Seventh-day Adventist Church just created this rich history that will sort of capture anybody's mind and thought about, how do I fit in with that? How do I actually grow and expand on what's already been there?
Kettering Memorial Hospital owes its name and its innovative spirit to Charles F. Kettering. The self-described screwdriver and pliers scientist possessed a tenacious, practical, problem-solving nature that changed the 20th century. In his early career, he worked for the National Cash Register Company in Dayton, Ohio. Here, he quickly distinguished himself by electrifying the cash register. During his off hours, Kettering and several fellow NCR employees, including his eventual lifelong friend, Colonel Edward Deeds, began working in Deeds' barn to tackle challenges related to automobiles. They called themselves the Barn Gang, and when they developed a better automobile ignition and lighting system, they quickly formed the Delco Corporation. Soon after that, Kettering achieved his next most famous invention, the automobile self-starter, which removed the hand crank from the front of cars and made them safer and more practical for the general public. Delco became part of General Motors, and Kettering became the vice president of research there, a position he held for the next 27 years. While the self-starter is his most famous accomplishment, Kettering's 186 patents included anti-knock gasoline, fast-drying automobile paint, an incubator for premature infants, and Freon. His home, Ridgely Terrace, was the first house in the United States to have central air conditioning. His wisdom soon became as sought after as his inventions.
Early in our days, we were made very aware of the uniqueness of Charles F. Kettering by listening to the radio. On Sunday night, he had a special program for an hour. And I don't know how I first happened to listen, but I was hooked from the first one. And I would plan every Sunday night to listen to this man who told story after stories of his own philosophy of life.
That if Thomas A. Edison, the Wright brothers, and Henry Ford had taken IQ tests, they wouldn't have gotten in the bleachers. Now why? Not because they were stupid, because IQ tests have nothing to do with the fellow that's being tested. And it's amazing what some of those people that you throw out do.
At the time of Charles Kettering's death at the age of 82, he held the distinction of being second only to Thomas Edison in the number of U.S. patents held. But he was also distinguished by his intense commitment to his community.
Charles he did his work here. He was here, he was with Colonel Deeds and the Wright brothers. This is where it started. There was always this belief of giving back to the community that had supported you.
During the polio epidemic in the 1950s, Charles Kettering's son Eugene and his wife Virginia were living out the Kettering commitment to caring for their community.
Where the Ketterings came in connection with Adventist healthcare was in Chicago. And that's when they were residing in Chicago. And there, Virginia was doing some volunteering at Hinsdale Adventist Hospital.
And she watched firsthand how that hospital took care of the polio victims who came into that hospital. And both she and her husband, Eugene, were impressed with the incredible compassion and care with which that healthcare was delivered.
And Eugene and Virginia were so impressed with the care at that hospital that they invested $1 million into providing care for polio through the iron lung machines.
I think Mrs. Kettering is the person that I remember the best. And I remember that through our many days of working hours on end, that you could look up almost any time of the day and there she would come to find out if there was something that they could do.
The Ketterings' experiences with Adventist healthcare weren't limited to the Chicago area.
The story came to me through Mr. Kettering in his visits around the world that he used to do for 2 to 3 months at a time. He would encounter 3 things: Coca-Cola, Singer sewing machines, and Seventh-day Adventist medical mission work, either a clinic or a hospital.
Adventist healthcare was established almost when the denomination was established. It came out of the early care and desire to make man whole.
We, believe that a person is a 3-part individual, you might say, mental, spiritual, and physical. And you need to have all those components if you're going to bring healing.
In his later years, Charles Kettering became more and more interested in medical research. So when he passed away in 1958, his family decided to memorialize him by building a hospital, a living memorial, on the family estate in Kettering, Ohio.
Eugene Kettering and his wife, Virginia, went to the city council and they said, we want to give Kettering a hospital. And that's when the council said, who's going to run it? And Mr. Kettering said, well, the Seventh-day Adventists know how to run hospitals.
The then CEO of NCR sent out a cablegram to all of his sales managers and asked 2 questions. Is there an Adventist hospital in your community, and is it a good hospital? What reputation? And those that said, yes, there's one, came back and always said, it is an excellent facility. So they agreed to go and visit Hinsdale. They went and visited Hinsdale and came back and embraced the Kettering's request that this be an institution of very high standards, quality, technology, and spiritual care.
An experienced hospital administrator named George Nelson was selected by the headquarters of the Seventh-day Adventist Church to head up the project. Mr. Nelson's inaugural trip to Dayton was something of a shock for the longtime Californian.
It was November 1959. I was tired. It was freezing cold. Rain was spattering on the windows of the yellow cab. Why did I let myself get caught up in this, I thought, as I signed the register in the old Biltmore Hotel. Morning came. The phone rang. This was Mr. Kettering's attorney. What are you going to do with the money? What money? I asked. The money in the Winters Bank. I've never been in the Winters Bank. Doesn't matter, he said. There's an account there in your name. It has a credit of $1 million. It'll be some time before you get through your planning and need the money, so you better get it invested and earn some interest. What an expression of confidence. I had not met Mr. Kettering. He only knew that I had been selected to lead out in developing the proposed Kettering Memorial Hospital, which later became the Kettering Medical Center.
When Mr. Nelson came, I know that the story goes that Mr. Kettering said, George, I've got the plans drawn up for the hospital.
The architects had been employed a year before I arrived and had prepared the plans, had the layout completed. They handed me the plans and asked me to okay them. I found them to be quite unacceptable insofar as the general organization of the hospital is concerned.
How is George going to go back to the benefactor and say it's all wrong? But he did, because to get off in the wrong direction is to end up at the wrong destination. And George reset that dial right then.
We spent a year making changes. A few of the major changes we made were provide 3 nurses' stations on each floor They had planned for one nurse's station to serve all three elements. It was located in the lobby in front of the elevators. And there are many other changes that we made, thousands of details that had to be decided.
And that's been legacy to Kettering, to do things intentionally, to do them right at the first, and then to make sure that we care for the people in the midst of them as we go forward.
Once the plans were properly in place, a groundbreaking ceremony was held on July 7, 1961. More than 1,000 people were in attendance, among them Dr. Vernon Luthus.
It was a tremendous feeling that a great philanthropist, Mr. Kettering, was going to build a hospital, giving it to Seventh-day Adventists to run and operate. And yet, it was exciting because the community didn't really know who Seventh-day Adventists were. They were just trusting the judgment of Mr. Kettering.
A group of Seventh-day Adventists who didn't eat meat and a few other things that were quite strange to the community made the community apprehensive of us.
They didn't know what to expect from an Adventist. The community and Mr. Nelson met together, and the meeting didn't start. And then after a while, we realized that they were expecting him to come in with a top hat, with a beard, yes, expecting him to look odd.
Soon, construction began, and Mr. Nelson and his team had a new, very daunting item on the to-do list: recruiting physicians and staff.
We tried hard to make friends with everybody in the community. We promised the local hospitals that we would not advertise locally so that we would not disrupt their services. We traveled the country and recruited people, and I think we're unusually successful in putting together an original staff.
When our banker heard that we were selling our business to go to work for a hospital, he called me in his office and he gave me an hour's lecture of the mistake that I was making, because he knew what we started with 10 years before.
They were pioneers, and they were all, must recognize, displaced people. And we were all new employees. And there was a great feeling of fellowship, and we all worked together in a great adventure.
It was such a beautiful family affair of all the new people who were coming here from all parts of the country, and some from overseas who had been missionaries.
When we came, we went to the bank up here at Town and Country to get a home loan, and we sat down, my wife and myself, with a builder, and they said, well, now, what is your salary going to be? And I said, you know, I don't know. I didn't even ask.
As construction on the interior of the hospital continued, there was one more addition to be made.
As the hospital neared completion, the Harrison family offered to provide funds to assist with the addition of another floor. Mr. and Mrs. Kettering promptly agreed to provide the difference, and a fifth floor was added to raise the capacity from 300 beds to 400 beds.
The completed hospital was more than just new, it was innovative to the finest detail.
If you take a look back at 1964 and you walked into the hospital as it was then, it was way before its time.
When we came in, when we first saw the hospital, at the lobby, we said, this is not a hospital, this is just like a hotel, first-class hotel. So that wherever we went, we said, well, we work at the Kettering Hilton.
One of the original things we did was to redesign a patient's room. Hospitals generally in those days had a little closet inside the door, so that if a patient needed a robe or a gown, he'd have to run over to the door in his shorty and get what he wanted, and he'd go back to bed. So we created a design with a closet, running water, controls for all the electric and electronic gadgets in the room, right at the bedside. It was quite an innovation.
In the design of the hospital, Mr. Nelson insisted on having an auditorium that was large enough to get the majority of the employees in one place at one time.
The architects did not find that they wanted to put an auditorium in the hospital. And Mr. Nelson was so intent on having that auditorium that he said to them, well, if you can't put an auditorium in there, I'll find somebody who can. So they did put in an auditorium, and that served for many years so that we could gather together as a family, and we did that even before the hospital opened.
On February 16, 1964, the hospital was dedicated in anticipation of receiving its first patient on March 3rd.
On the day of the dedication, Mr. Kettering had invited over 200 of his friends from all over the world. And Dr. Annis, president of the AMA, was a keynote speaker. And Dr. Annis said, if you are so lucky to have Seventh-day Adventists run your hospital, you have made a right choice because they run the best hospitals in the world. Mr. Kettering, he said, I felt 10 feet tall, at that time because he just felt vindicated that the community would know that he had made a right choice in inviting Seventh-day Adventists to run his hospital.
With everything in place, the doors were opened for the first patient.
I was involved with the opening up of Kettering, and it was slow to begin with, because that was sort of strange to have a hospital with many, many beds and not full.
Remember that on day one, we admitted one patient, and then later in the afternoon, 3 or 4 more. But at that point, we had 500 employees. And when the door was opened for patient number 1, everything in the hospital had to be ready to go. When the patient number 1 was discharged, then you send a bill to Blue Cross or some insurance company. 30, 60, or 90 days, when they get around to it, they send you part payment, and then you bill the patient. Eventually, you get some money flowing. That was difficult.
There was a time when Mr. Nelson had to go to Mr. Kettering because they weren't going to be able to make payroll that pay period. And so Mr. Kettering provided the funds for a bridge loan to get them over that hump.
I often said about Kettering, you could never get bored because it was always moving on towards something more.
I really enjoyed working here. I couldn't wait to get to work in the morning so that I could be part of this great organization that was starting.
We had one surgery the first day, one bronchoscopy. You had to get your staff oriented and in place, and then it started to grow pretty rapidly. And one of the things we did was encourage some of the surgeons to start office hours in the morning and worked in surgery in the afternoon that hadn't been done in town before. And that took off, and our surgery just sort of bloomed.
The medical staff was led by its first chief of staff, Dr. Robert Taylor. This was a volunteer position with no support staff, and the composition of the hospital's medical staff was very different than it is today.
One of the characteristics of medical care at that time was that essentially all hospital patients were cared for by their primary care or family physicians who would follow them to the hospital and render care.
In my family practice, we were really busy. We delivered our own babies. We didn't send them off to an OB/GYN. We did it ourselves. My practice alone was something like 13,000. It was a lot of babies. And I made house calls too.
As a young man, I was full of vim and vigor. And when I would go to the other hospitals, if you request something, it took years or so difficult to move ahead. And, they didn't have the vision. Kettering had the vision. They were visionaries. So they were always wanting to allow advances in medicine to be utilized. They didn't impede us.
At that time, all the groups worked in every hospital. I was the first one to limit myself to one hospital. I picked Kettering because I could actually get things done. Anesthesia would do exactly what you asked. They were very good and very safe. And the x-ray department was great because if I asked for a study, we could get the study. It wasn't a debate about how much film or that may cost too much to do. It was better for the patient.
It was just amazing to watch how the organization was able to recruit physicians of the highest caliber I got here 12 years after the hospital opened. By that time, we had brought on Dr. Ted Bernstein for neurosurgery, Dr. Pohl for orthopedics, Dr. Nicholson for oncology, and of course Dr. Krumholtz for pulmonary. We had Dr. Schuster to start the first cardiac cath lab, Dr. DeWall, who invented the heart-lung machine that was used all over the country for open heart surgeries. He came in as our cardiac surgeon.
I was very blessed to be in heart surgery because here you're taking people with a very limited life expectancy, but you're able to give them a normal lifespan.
Dr. Richard DeWall worked closely with Dr. Benjamin Schuster, who had performed the first cardiac catheterization in Dayton.
When he first started to work over at Kettering, they had no catheterization laboratory for diagnosis. So what he did was take the patients to the X-ray department, and we used the standard X-ray machines, fluoroscope, for his catheterizations, which I don't know how in the heck he was able to do it, but apparently he was able to get enough definition to get basic catheterizations work. Well, this went on for a few months, and finally Virginia Kettering got into the act, and she very kindly came across and built the first catheterization laboratory.
And in those days, we were among the pioneers in the country, early days. Now, of course, there are many people that do it, but the early days were quite memorable. It was like going across the prairies in a Canastota wagon compared to the way you do it now in a beautiful big car rolling along the highway. Big difference.
Open heart surgery during those pioneering days was quite different than it is today.
I remember when I came here, when a heart surgery was planned and the whole hospital was kind of, in standstill and looking, and everybody was whispering, because there was a big deal when a heart operation was done. And of course, that developed to the point that we did 4 or 5 surgeries a day in Kettering Hospital.
Growth rapidly occurred all throughout the hospital.
The emergency department was very, very small because when they had done the studies for planning the hospital, they didn't think they needed an emergency department. There was plenty of other services available.
The emergency room in 1970 consisted of a bay with curtains and perhaps room for 5 or 6 patients at a time. Much of the actual work in ER was done by the surgical and medical residents in the hospital who would moonlight.
And so one of the earliest expansions was to build a new emergency department.
The thing that really impressed me about Kettering when I came here was I didn't really expect a hospital that was basically as good as the university hospitals were, and it was. It was as good.
We worked hard, but it was very gratifying, and we all loved what we did. It had to be clean, it had to be professional, it had to be top-notch. We had to be the best. And that's not a bad way to be.
Mr. Nelson said, now Bob, he said, Gene Kettering and Mrs. Kettering have told me that we really need to have an educational program. And the reason is he's never seen a good medical center, a substantial medical center that has any renown, where it doesn't have medicine with education programs and research.
Kettering Memorial Hospital's plan to create and operate its own college faced a challenge very early on.
When we first went to the North Central Accrediting Association to show them our plan and ask if it would qualify for accreditation, they said no, because hospitals do not run colleges. Colleges run hospitals. So we came home and wondered what to do. We were dejected but not discouraged. We changed the name of the corporation from Kettering Hospital to Kettering Medical Center. The Kettering Medical Center would then run the Kettering Hospital and the Kettering College. That was acceptable.
In 1967, the Kettering College of Medical Arts welcomed its first class.
I was very struck by the whole sense of family and the excitement of a new place. Clearly everybody was excited about starting the college, and people had come from all over the world.
Those first beginning faculties, none of them said, my job description is thus and so. You just did what needed to be done, and everybody just worked hard at it, and it was a kind of an atmosphere I just thrived on.
Part of the philosophy of the college was that we were going to graduate students who were better prepared than other schools, and our courses were more rigorous. There was a commitment to excellence in the physical plant and in the people.
Education has been kind of a cornerstone of the Kettering spirit and vision ever since its inception of the hospital, and medical education no different. And Dr. Alvin Hedrick was the director of medical education. He was the founder.
He was like a father figure for all of us, and he was always there to help you out and guide you through.
He was just such a kind and calm demeanor. One of the things I aspire to emulate in him is that he could bring a group of physicians and administrators to the table and really work through projects and see both sides, but get the group to respond to each other very effectively, but in this calm way.
It is very much a family. The senior doctors stay. I mean, we had physicians stay even after they stopped practicing. Dr. Schuster stayed. He came every day to the lounge. He was part of our family.
My mother, who trained, got her RN here in Dayton. One of the things she always told me, she used to say, take care of your nurses because your nurses will take care of you. And I never forgot that. And when I got to Kettering, that role was very, very easy to do because our nursing team, absolutely delightful to work with. A lot of trust, a lot of empathy. You could tell that they were there for the patients, and that's what it's all about.
We really made ourselves part of a team before teams were invented, because that was 30 years ago. Now everybody talks about teams, but that was here from the start.
The nurses and the staff took good care of me, you know. And when you're on call every other day, you know, you got to depend upon them a lot.
As we were working feverishly to get the hospital open, the housekeeper had made the comment to me. She says, well, I'd like to know who Mrs. Kettering is. And I says, well, right over there is Mrs. Kettering. She looked over there and she said, I didn't know that was her. People say, oh my, this is a Kettering family and they're ready to jump. But they were just as practical as anybody that you would ever want to meet.
Mr. Kettering, of course, was an engineer, and he was interested in everything that related to engineering, from surgical instruments to the big diesel standby generator over in the power plant. Mrs. Kettering also was interested in everything, more interested in decorating and color than Mr. Kettering was, that she had a part in practically every color that was used in the interior of the hospital.
A truck drove up in front of the hospital one day before the hospital opened, and Mrs. Kettering appeared at George Nelson's door, his office, and said, I would like to have a hammer and a man. And he went out to fulfill her wishes and came back with the hammer, and he said,
here's your man, let's hang the pictures. I didn't know where they were. We walked out to the lobby and there was a moving van in the driveway just outside, and in that was a stack of pictures, some paintings and some fine prints, scores of them, along with some furniture for the lobbies on the several floors.
They went throughout the hospital and hung pictures.
Well, I'd hold it up. She said, no, that's too high, put it lower, a little lower. No, another couple inches down. And when we got it where she wanted, that's where I'd hang it. We went back to the office at the end of the day, and she sat down and said, George, you're the first man I've met that knows how low a picture should be hung. I hung them where she told me to hang them.
We were invited to their home quite a few times with the faculty and with student groups, and he loved to take us all downstairs and show us his Johnny house back there.
You don't think of having an outhouse in a house like this, so you walk into this funny little outhouse in your grandparents' home, and on these walls were all these signatures. You've got Orville Wright and you've got Thomas Edison, and it was the most amazing thing to walk down there and just stare at all these names that you're studying about in school.
Susan's grandfather, Eugene, was an accomplished engineer in his own right. His work perfecting the diesel engine for locomotives revolutionized the railroad industry and helped bring an end to steam-driven trains. His grandchildren, however, were impressed with a different kind of accomplishment.
He was fun. He had a great smile and a wonderful sense of humor, and he had one talent that I thought was pretty impressive. He could walk on his hands. And I think as a child, that was pretty impressive to have your grandfather, because when you're young, you think of your grandparents as being so old. And I know I'm probably about the same age now that he was when he was doing that. And I still can't walk on my hands, but he actually did it up the stairs here. I remember watching him go up several stairs on his hands and was always intrigued by that fact that he could do that.
After Eugene Kettering passed away, Virginia Kettering took up the mantle, and she continuously prodded the hospital to keep expanding, not just physically, but also in the scope of services that it was providing.
She would always be willing to talk and listen to anybody. I think everybody was her friend. But she also knew how to get things done. She knew how to work with the community and the other community leaders.
She moved about with a charm that you would apply to those who were in royalty. You know, very graceful, very courteous, very kind to employees. That was her character.
I learned that behind that gentle and gracious set of expressions, there was a lot of energy and fire, which I got to experience in a couple of times. But I felt immediately a warmth and rapport that it only grew over the years.
I took care of Mrs. Kettering for a number of years. I saw her daily. She got to the point where she was having some problems with her aortic valve. And she says, I'm having surgery at my hospital. And she's a very forceful woman. She had very strong ideas about what she wanted and what to do, and she did it. And that's the kind of woman she was. So she had her surgery at Kettering Medical Center. It was her hospital. She did well. She lived another 5 years. She did a lot of good things for the Dayton community in that time, and she was very, very conscientious about where their money was going and how it was going to affect the community. She loved Dayton, Ohio. She was a great philanthropist. She knew how to give away money and to the right causes.
Kettering Medical Center was able to maintain in the greater Dayton community and beyond that through Ohio a high quality of care, very largely due to the vision and insistence of the Kettering family.
One of the many areas at KMC that received support and encouragement from Mrs. Kettering was neuroscience.
The viewing wand was the first computer-assisted surgery device. It was built in Montreal, and Kettering was the second hospital in the United States to have computerized surgery. So it was just thrilling. And the difference in what you could do was amazing. You had to respect the technology, you had to know what you were doing. But basically you could see things the way you had never seen them before. It was a fascinating time to be there. And the other thing that was interesting was Kettering was in the forefront of developing ways of manipulating images. And we were able to take any image and superimpose it accurately in another image, so that MRI, PET scan, CAT scan could all be made into one picture that was accurate. And that was also a technology that came from Kettering first.
Kettering has maintained its innovative spirit, which is a wonderful thing. You know, Mr. Charles Kettering used to say, don't forget, you're going to spend the rest of your life in the future. So if you don't innovate, if you don't do new things, the future is not going to be bright. So you got to do that now. So the future will be bright. Okay, because that's where you're going to spend the rest of your life.
That's our one best practice, is we're going to change, we're going to be better, we're going to keep changing, keep being better. We don't have to like it all the time, but we're very good at change.
It is steeped in a culture of caring, of innovative spirit, of doctors that are not afraid to necessarily challenge the status quo, but when they do, we want good things to come out of it. And just this trustworthiness. There's a certain trust between leadership, physicians and physicians. We're developing a trust, because if you don't have trust, sometimes you can't move forward either. All of those things and more, I think, make up that fabric that is Kettering.
I've often said that healthcare is where the rubber of theology, the rubber of what we believe, meets the hard road of life as people experience life.
When they would call me all hours of the day and night to come in for emergencies, I always just said a brief prayer for guidance, for calm, because that spilled over onto the people in the room.
Dr. Luthus was one of the people who really inspired me. He was an anesthesiologist, and when he would come up to visit the patients the night before surgery, he would offer prayer with them. And the patients always seemed to appreciate that.
The Lord used him. He walked with them daily. His patients loved him. One of his trademarks was that he would pray with patients. So he did change lives wherever he went.
I saw an older lady. She says, "I've waited a long time to tell you this, but I wanted you to know that the prayer that you offered for me on the day of my operation, on the day before my operation, it was that prayer that made me a Christian, helped me to become a Christian, and today I'm a Seventh-day Adventist. And I just wanted you to know that." And this was almost 25 years later. You know, that's part of our mission, is just to be a channel for the love and care of Jesus Christ to other people. And wonderful things happen when we do that.
We have an environment here where one is not ridiculed or criticized for that kind of activity. It's not required that people do that, but we have an atmosphere where people treat each other with respect.
And it doesn't matter what denomination. Christian people are Christian people. And that's why a lot of people come to Kettering to work, because they want that atmosphere. They want the comfort of that kind of family.
Every day, a patient touched you, a patient's family's touched you, and you're going, this is why I'm here. This is what I'm supposed to be doing. And when you know that God is directing your steps, it's that joy that you have.
I think in terms of reaching people, you won't necessarily reach them just by preaching specifically the gospel, but you can reach them by taking care of their needs, their physical and spiritual needs.
One of my members of the church was having open heart surgery, but that night woke up around 12:30, recognizing that his surgeon was going to be holding his heart in his hands in about 8 hours. And he did what we all do when we're lying in a hospital bed and don't know what to do. We're counting the holes in the ceiling tiles above us. And he said the door to my room opened, and a lady came in, and she was dusting the floor, tidying up quietly, and she noticed that I was lying there because I turned my head. And she said, "You're having surgery tomorrow, aren't you?" And my church member said, "Well, how do you know?" She said, "Your eyes are like this, and you're wide awake. It's like what a lot of people do." And she said, "I want you to know that this is a wonderful hospital. We pray for our patients before they come, even though we don't know their names." And my church member said, "Well, prayer is important to me." And she said, "Well, I'll pray for you tomorrow and remember you in my prayers." And he said, "Oh, thank you very much." And she said, "Well, prayer is important to you. Let me pray for you now." And she came over, Pastor, and she put her hand on my elbow, and she prayed, and it was just like an angel whispering in my ears.
And when we do that, we will become a better organization. If you feel comfortable praying with a patient, pray with that patient, if it's appropriate. And I can tell you that when you are taking a patient to surgery, there's nothing more calming than put a hand on that patient and pray for them. When that physician is ready to do surgery before they're putting them out with anesthesia, pray with that patient as a physician. You want to see a calming effect? Prayer works. George was a very giving person. I mean, when you met George, he was humble, he was a true servant. He felt called, and he was up to that calling and did an outstanding job.
You respected him when he walked by. You stood up a little straighter because he was always standing straight. And it was just, he did that in such a human way.
He wanted it done the right way. It was always the right way, in detail. For instance, you look at the clock that he built, it was done perfection. You go to his home and you look in his workshop, it was like you could go eat off it.
Of course, George Nelson ended up being my next door neighbor, and he'd had illness in the family with his wife, and that's why he left as soon as he did, because he was only in his mid-60s. So it was good to have him close by.
Dr. Schaffner was the only administrator at KMC who was also a physician. In addition to being a great administrator, he spent his Fridays in the emergency department at the hospital working as a physician. During his time at Kettering, extensive construction took place. He was the one who had the foresight and made Sycamore Hospital become a reality.
One day, Marlowe came into my office and said, "Bob, I've been thinking about groundbreaking down there at Sycamore. What would you think if we used dynamite?" "Dynamite?" "Yeah," he says, "how would it be if we have a red, white, and blue dynamite?" Marlowe, I said, "I love that. I've never heard of that. That is unique. Only you would come up with that idea." So that's what we did. And boy, when she blew, she blew.
Robert Willett was Kettering's third president. He started as employee number 29 and was there with Mr. Nelson from the beginning.
He had a wonderful belief in what Kettering was capable of. You take a look at the original plans that was there in 1964. It's been changed dramatically. But Kettering's the house that Bob built.
Bob kept Kettering at the forefront of what was going on, not being just a little hospital down the road, but making a sizable contribution to healthcare in the area.
Mr. Willett was responsible in part for many of Kettering Medical Center's first, like the first CAT scanner, the first PET scanner, the first MRI. He believed that if a hospital or a facility was on the cutting edge of technology, that it would be successful because patients are obviously going to want to go to the hospital that has the best care available.
I worked with Frank for most of my years. He came to America when he was 16 without any shoes, a refugee from Cuba. And what's kept him going has been that consistent mission. The church is at the center of what Frank does and who he is.
When Frank Perez became Kettering Medical Center's fourth president, the hospital was going through a difficult time financially. Morale was low and support from the community was in jeopardy.
He used a principle that was very convincing. It's called MBWA, Management by Walking Around. That meant he would go out on the floor, talk to the employees. He built a team of leaders.
Frank received many awards and recognitions on behalf of Kettering Medical Center during his time as president. One of the most significant came in 2007 when the President's Club of Dayton bestowed upon him the Legion of Honor Award, recognizing his years of service to the community.
Frank moved over to the head office as the chair and CEO of what was rapidly becoming the network. He brought Fred Mancher in as president of Kettering Medical Center, and they were off to the races.
And when I heard what Fred's experience was, perfect choice.
Fred's leadership was a perfect fit for the legacy established by the founders. He took excellence to new dimensions at Kettering Medical Center.
And some of the things that Fred did, particularly on his relationship with the physician, I marveled at where his office was set up and how physicians could have direct access to him, come into their space, relax during surgical processes and so forth. And it was just a unity and as part of a community that contributed to all that this hospital offers.
Fred Mancher is a phenomenal leader.
He has vision, he has experience, he has enthusiasm. He has been an incredible asset to Kettering Health Network.
I call Fred five-star Fred, because Fred has a way of affirming people and encouraging people, has a great relationship with his staff, with his team, and recruits wonderfully, and leads with mission right in the very center. He's very mission-centric.
I don't want to forget Roy Chu, an outstanding, really I call a bright young man, but no nonsense, but well-equipped intellectually, spiritually.
Roy Chu started working at Kettering Medical Center in the mid-1970s, about the same time I did. His career at Kettering Medical Center has been nothing less than phenomenal and has taken him virtually all over the organization. He is a hard worker, and no one understands the Kettering legacy better than Roy. He's an amazing leader.
When Roy first came to Kettering as a young respiratory therapist and teaching and working in that area, Bob saw within him leadership capacity, a capable mind, and he sent him off to Stanford University to get a degree in leadership and hospital administration. That was probably one of the best expenditures of Willett's time there at Kettering.
I've been here 44 years, and I don't want to retire because people are so wonderful to work with. So those people that are out golfing, and they go out and they praise when they hit a hole-in-one. And I tell my patients, I hit a hole-in-one every day.
Some people's heritage is part of their history. People will tell you ours is part of our culture today. Innovation was one of the big factors of the Ketterings, and it's something we're always looking at how we can be better.
Kettering Health Network has grown phenomenally, probably more than Eugene and Virginia ever imagined. And I think we as leaders are building on the shoulders of those who came before us.
I think the blending of the Kettering legacy and the Adventist community commitment to compassionate care makes it unique.
In this organization, you have as your base, your mission, your values, your vision, your people. It's all about your people. You can have great bricks and mortar. You can have great equipment. If you don't have the right people at the base, what are you going to be? Bricks and mortar? Can't do anything. It's your people.
Some of the nicest people in the world, I thought, were all concentrated here at Kettering Hospital.
I think that the Ketterings would be extremely proud of what has been accomplished at their hospital. I think they would just be overwhelmed with the advances that have been made and how we have really achieved national prominence in the areas of clinical quality. We have consistently been ranked in the top 10% of hospitals nationally, whether it's U.S. News and World Reports, whether it's top 100 hospitals, Health Grades, any of those organizations consistently rank us at the very top, and they would be very proud.
I think the foundation that Kettering was built on is strong, and I think that as long as we look to our past, it'll guide us along the way to our future. You know, just hearing the history of Charles Kettering and knowing that history, hearing my dad talk about that history, it's just really an exciting thing to be a part of.
They saw great things, and they were about creating great things. And I don't think they would ever underestimate the capacity of people with mission and commitment to accomplish great things.
People recognize that this isn't just about doing my job. This is about being and creating community, creating hope, creating that awareness of others. And this is a mission-minded place with mission-minded people, and it feels different. It's entirely different. And that's a blessing.
Come along the journey with us. See how it looks in another 10, 20 years. And you'll find that, again, changes will take place. They'll continue to do that, and we'll improve.
vision that began long ago in the hearts and minds of the Kettering family. A vision which has become a reality and now extends through 8 medical centers and more than 120 outpatient facilities and physician offices. A vision carried on by the Kettering Health Network family to continue our mission of improving the lives of the people in the communities we serve.